Well, Dr. Terry, welcome to the Health Babes podcast. Thank you for joining us.
Thank you for having me.
Yes. So a little bit about Dr. Terry. Dr. Terry Wahls is an Institute for Functional Medicine certified practitioner and a clinical professor of medicine at the University of Iowa, where she conducts clinical trials. In 2018, she was awarded the Institute for Functional Medicine's Linus Pauling Award for her contributions in research, clinical care, and patient advocacy. She is also a patient with secondary progressive multiple sclerosis, which confined her to a tilt-recline wheelchair for 4 years. Dr. Wahls restored her health using a diet and lifestyle program she designed specifically for her brain, and now pedals her bike to work each day. She is an author of the Wahls Protocol, a radical new way to treat all chronic autoimmune conditions using paleo principles. She also has the Wahls Protocol, Cooking for Life, the revolutionary modern paleo plan to treat all chronic immune conditions. So welcome.
Thank you for having me.
Yes.
All right, Terry, we like to start out every podcast, and especially with you, because this is what I see you posting mostly on Instagram. Yeah. I want to know, what did you have for breakfast?
Tea.
Or did you have breakfast?
Oh, yes.
No, I haven't eaten in 36 hours.
Okay.
Wow.
Terry does a lot of fasting. So, okay. Well, if you were to eat breakfast today, what do you think it would be?
Tea.
Tea.
So I haven't had breakfast. I will have generally one meal a day. And so when I do get around to eating, I will have a bunch of greens, typically a big salad, occasionally cooked greens, a source of meat. Today, we're going to be having grilled chicken from Primal Bird, so I'm actually quite excited about that. We'll have grilled garlic. I'll have a bunch of raw peppers, daikon radish, and probably some raw cauliflower. I'll have my tea, of course. And I will have a smoothie, probably with some matcha green tea in it as well.
Matcha tea. What's in your tea that you had this morning?
So green tea and calendula leaves.
Okay. All right. Well, that's
awesome.
Good to know. What did you have, Krystal?
I had a big veggie stir fry with, really good sausage, good quality meat with kale, sweet potatoes, all the veggies, carrots.
Superb.
Yeah.
That's what I had broccoli, cabbage, like a cabbage blend, sauteed it, and then some chicken patties.
Yeah.
What is interesting about all that, Becky, of course, is we're eating normal, great food, vegetables and protein for our meals. And there's been such an effective marketing campaign by Kellogg and all his compatriots that convinced us we need to have carbohydrates for breakfast. And for thousands of years, humans had vegetables and protein for breakfast. We didn't have any of this carbohydrate in cereal stuff.
Right.
I don't do well on high carbohydrates personally, and I know that everyone's different, but I don't really label my diet. I guess it's definitely paleo, but then there's the low histamine aspect, and but I am much better on meat, fat, and veggies with very low starch and no processed food. I can't tolerate it at all.
And that's the way our species evolved. We had plant material that was high in fiber, very low in carbohydrates, certainly nothing easily digested with a glucose spike. And we had protein. We may or may not have had much fat. Depending on the season, we probably would have had a lot of fat. But we were often in ketosis because we had to work so hard for our food.
Right.
Yeah, and I just finished Dr. Terry's practitioner certification. So
yes,
it
awesome.
is such a great course for any practitioners listening.
Yes.
You have got to take this course. It's amazing, and I know a lot, but I am always wanting to learn, and I learned a lot from it. So
it's never ending learning, isn't it?
Yeah,
it's always expanding.
Part of what I love about my course is I really help people understand that people change because they want to change.
Yeah.
It's never enough to give them just information. So we really dive deep into how the process of change happens and how the ancestral ancestral medicine, evolutionary biology is at the core of creating health.
Yeah, it's so true. I love how into the nutrients you get and the explanation of why we need what we need. And, there's different phases to Dr. Wahls' protocol, which is great because not everybody is right for each phase. That's what's so great about this. And I always talk about, how there's no one set diet for every single person. So this is one of the many reasons I loved that program. So I'm really
Thank you.
to put it out. Yeah.
I'm excited to learn more.
It's really, Krystal's going to take it too.
Yes.
Oh, great, Krystal. Glad to hear that.
Yes, absolutely.
All right. Well, let's get going on talking about some of the stuff that we wanted to kind of hit home with today with some people that may be suffering with multiple sclerosis or autoimmune disease, or even have loved ones who have this going on, and they want to know, how do they support them? So, you suffered with MS and trigeminal neuralgia, which is an awful, awful, awful thing. I mean, from what I've read, there's a very high suicide rate with trigeminal neuralgia because of the pain
Absolutely.
level.
I completely understand that. Imagine what happens when light, sound, breeze, talking, speaking triggers electrical pain from your temple down across your face. And when it would turn on, my pain would be so severe, my knees would buckle, I couldn't maintain standing. It could be so severe that all of my sensory input is obliterated. Vision is replaced by white. I can't hear. And it lasts just for an instant. Occasionally it would last for up to a minute. And then, I'm not breathing, I'm not talking, I'm freaking out my family because you just cannot function until the pain stops. If that becomes permanently on, you cannot function.
No.
And so I certainly understand before we had treatment modalities, that was the solution that people would often turn to because of just how intense that pain is.
Yeah, I can't even imagine that. I mean, I've suffered with migraines just from having neck issues and from having histamine intolerance. And that enough has been bad. And I don't have trigeminal neuralgia, and I cannot even imagine what that was like for you.
On the other hand, I also see it as a tremendous gift now.
Yeah.
Because I have trigeminal neuralgia, I have this exquisite biosensor of, is my brain inflamed?
Yeah.
Is my spinal cord inflamed?
Yeah.
If it's inflamed, the sensation on my face is abnormal and the trigeminal neuralgia turns on. And so, I just had my, because I practically go in and get my MRIs updated. So I just got my update with my neurologist calling me saying like, oh my God, it's great, and I think I can't wait to bring you in because finally it looks like those lesions in your cervical spine are gone. So I can't wait to see that because we had assumed that those were going to be permanently on because, when I recovered, we updated my MRI. They were still there. My neurologist was disappointed. It goes, but Terry, you've had them for 20 years. So of course they're going to stay. But we'll see. Now, I can't wait to go back and see my neurologist. That'll be in July. So then he offered to let me come in right away. So no, we'll wait till July. But I'm looking forward to it.
Well, you'll have to let me know because I'm very curious. And that someone that I love very close to me has MS. And so we're in the beginning stages of all this, but.
What a blessing to know Terry and to learn from her too with, having loved ones.
It's amazing. Yeah. Terry has been so helpful for us. So
that's so awesome.
Thank you for that.
Terry, tell us a little bit more about the therapeutic lifestyle clinic you created at the VA.
Well, when I had my recovery, it changed how I am treating patients in my primary care clinic and in the traumatic brain injury clinic. So I'm talking more and more about diet and lifestyle, less and less about drugs. And it drives my partners crazy. They complain to the chief of staff, calls me in to say, Terry, what the hell's going on? People are really upset with you. Now,
Wow.
fortunately, I'd been quite prepared. I brought with me an armful of my scientific papers, and I went through them explaining what I was doing and why. And I won my chief of staff over. And I was able to continue, using more and more diet and lifestyle in primary care and traumatic brain injury clinic with really, very impressive results.
Yeah.
Then my chief of medicine called me in to say, Terry, we're pulling you out of the resident clinic because I want you to start your own clinic. And it took us a while to get all of that in place. And I also ended up leaving the traumatic brain injury clinic. And as we created this new clinic, I negotiated that I could have a registered dietitian to work with me. And I went to the chief of medicine and the specialty medicine clinics. And I said, we're creating this clinic. We're going to use diet and lifestyle. We're not using drugs. We'll have just some very basic primary care type of labs. And we want to take your most difficult cases, people you can't help. They need to know I'm not giving drugs, it's just going to be diet and lifestyle. And so, and I also went to the pain clinic. We got just a handful of people to come, had remarkable success with these folks. And then, well, we got more and more and more. And then we started getting an avalanche of people coming in.
That's how it works, right?
Correct. You have to have success. If you show you have success, word of mouth, breed. Another thing that I did is I invited primary care, specialty medicine physicians and their staff to come sit in our clinic and go through the clinic to see what we did. And, it took a few, again, just a few came. And they were impressed. Then a few more came. So within 3 years, we kept having to redesign our clinic to accommodate the demand because I didn't want to make people wait.
Yeah.
So we went from one-on-one appointments to group appointments. As I got more skilled at this, I could do larger and larger groups. The other thing that I learned was that we would let them bring a family member to clinic.
That's a great idea.
Because they need, I realized this is a family intervention.
It really is.
Not an individual intervention. It's a family intervention. We're teaching the family the root cause of illness. We're teaching the family ancestral health, evolutionary biology. We're teaching the family how to meal plan, create a shopping list, how to cook, how to meditate, how to move.
I love that.
And because we're in the VA has electronic medical records, so they could track the people that I saw. We could track their blood pressure, their blood sugar, their labs, their lipid values, their glucose, their A1C, their vitamin D levels, their homocysteine, their C-reactive proteins, their insulin levels, their medication use. And I'm giving reports back originally just to the chief of medicine, what our success rate was. Then I'm giving my reports back to the chief of staff and the executive committee of the hospital. And that, again, we're showing that weight's going down, blood pressure is improving, blood sugars are improving, A1C is improving, medication lists are simplifying.
Yeah.
Pain meds are going down. And then VA central office in DC hears about what I'm doing, and they come out to see me, and I'm like, okay, is this how is this gonna go?
Right.
But they were very impressed with what we were doing. And so then I write a grant, we could add more staff. And by then, I've been doing this for 3 years. My research program is growing, and now I'm having to make a big decision. Do I grow what I'm doing outside the VA? Do I make this bigger still? And that's why I decided to retire from the VA, launch our certification program online, and have a bigger commitment towards my educating the public and clinicians as well. I did not want to stop my research at the university because if I'm going to change the standard of care,
Research.
I have to do the research, and I want to change the standard of care. So and that was a big decision because I really love the VA. I love my vets. They've taught me a lot. But I hired the staff. I retired from the VA, hired the staff, continued the university, and then expanded my work to the public and to the practitioner program. And that's gone really very well. And then, of course, this year happened. And of course, we all had to figure out what to do in this new environment.
Right.
So true. I was so grateful to already be virtual at that point.
I know. Yes.
A lot of people had to make a switch and it was very hard. So yeah.
Yeah. Life happens and you have to figure out how, where's the gift in that difficult circumstance.
Yeah.
Exactly. The ebbs and flows.
That's so true. Well, why don't you tell us more detail about the clinical research that you're doing?
Sure. So we've done multiple trials. There was the first trial. It's a single arm in progressive MS. And the big question was, could people do the complicated program that I did? And if they did we hurt anyone? And then was the trend in the right direction? Because when you do a small safety and feasibility trial, you don't expect to show positive results. You have to show you don't hurt anyone, they can do it, and the trend's in the right direction. So people lost weight without being hungry. That was our big side effect. So that was okay. People could actually implement the diet very consistently. They could meditate, they could exercise, they could do the e-stim. So they could do everything that I did. So that was exciting. And then to our amazement, the fatigue went down quite remarkably, 2.38 as a group. That is huge. 0.45 is clinically meaningful. So huge reduction in fatigue. And the p-value, 0.0005. So that's, pretty big. Quality of life improvement, I think was 16, and a quality of life improvement of 5 was clinically meaningful. So that's so very exciting results there. Then we do a wait list, randomized controlled, just on the diet. Now we're studying relapsing remitting MS, so a little early in the disease process.
Yeah.
We use just 12 weeks. And we train people on the diet. We see them, do their assessments, and randomize them to either get the diet or have to wait 12 weeks to get the diet. So again, we show that fatigue goes down, quality of life goes up, mental health improves. And by the way, motor function improves in the intervention group compared to the control group. Then the next study we do is the Wahls diet versus a ketogenic version of the Wahls diet versus weight loss control. And again, fatigue goes down, quality of life improves, mental health improves. And I was a little bit surprised. The Wahls diet was better than the ketogenic version of the Wahls diet. I thought the ketogenic version might be better, but the Wahls diet was better. Then the next study is a low-fat diet compared to the Wahls elimination diet. So this is a swank diet versus the Wahls elimination diet, much larger study. It has a 12-week observation period, 12-week intervention period with support, and 12 weeks follow-up without support. And so very exciting. We've analyzed that data. We're very excited about that data. We've written it up. We will be submitting it for publication. And I don't get to tell you more until it's been published. I'll also tell you that because we care so much about diet, we analyzed what people were eating at the baseline with weighed food records, after the end of the observation period, at the end of the intervention, at the end of the follow-up period. So we know what people ate. And the big question of, are we creating nutritional deficiencies with the restrictive diet, either the Swank diet or the Wahls diet? I know that answer, but again, I don't get to tell you that
Tell us.
until we write it up.
I love it.
And we also did a very detailed vision assessment with ocular coherence tomography on a smaller subset of folks. We are analyzing that data. As a matter of fact, in a couple of weeks, I'm meeting with the ophthalmologist who's looking at that data. So even I don't know the answer to that question. And then the other set of data that we have that I'm very, very excited is we collected poop at all 4 points as well. And so I'm having conversations with my immunology, microbiology guy. And we're going to be analyzing the microbiome and looking at a cross-sectional, how the microbiome, what kind of relationship that has with various quality of life and fatigue measures. And then, so that's paper number one. Then paper number two is, how does that change based on the assigned study diet? So we'll be able to begin to look at what are the mechanisms by which food impacts the microbiome, impacts those clinical outcomes. So we have lots of incredibly exciting papers ahead of us. And this is the stuff I love to do, because when we understand the mechanisms of why food is so powerful, it will be easier for my neurology colleagues, my subspecialty colleagues, to say, you know what, we all got to be talking about food, because that gets at the basic science of why people are ill and why people begin to recover.
Great.
I have a question that's kind of just, something, I'm wondering if you see, if someone's following the Wahls protocol to the T as far as the diet goes, they're doing the Wahls paleo basically diet.
Yeah.
They're, supporting their mitochondria. They have already supported the microbiome. They're meditating. They're doing basically all the things that we know can really help to keep them as healthy as possible and as symptom-free as possible. Do you think it's a normal thing for someone with MS to still occasionally get a symptom that comes and lasts a little
sure.
and goes?
Sure. So we'll take me.
Mm-hmm.
So, clearly I'm doing a great job of my self-care routine, and I keep refining it, improving it. My trigeminal neuralgia will still turn on.
Yeah.
What causes it to turn on? Viruses. So if I get a viral infection, my face pain will turn on. Particularly if I have a fever. Fever will trigger the face pain. When I was traveling the world, doing, speaking at all these conferences, that what we used to do that. I get invitations all the time, and so if I discovered that if I flew more than 6 hours of airtime in a month, my face pain would likely turn on. And so I was like, okay, I had to, keep track of how much air travel was I doing in order to not get triggered. If my sleep is disrupted, one night I'm okay. 2 nights of sleep disruption, my sensations is likely going to turn back on. And so over time, another thing that will happen is as you age, we have perhaps more vulnerability. My immune responses supposedly have immunosenescence, so immune aging. So maybe this will become less of a problem now that I'm 66.
Mhm.
But my mitochondria, yeah, other foibles will happen due to aging. So my guess is I may still have vulnerabilities that I have to pay attention to.
Right.
Stress, toxins, infections.
Yeah.
Mhm. Drivers.
And if I come to Becky's house
Mhm.
and Becky makes me food,
Mhm.
I'm sure she'll make a delicious food. And she goes to buy some gluten-free processed food that she thinks is going to have a fun treat. She may
Mhm.
not be aware that 20% of gluten-free labeled food has gluten in it.
Oh,
Right.
yeah.
Right.
Or cross-reactive foods, right?
Yeah.
Correct,
Like
correct.
in the body. Yeah.
So this has been a way easier year for me because I don't have to eat anyone else's food. I'm just eating my food. So I could be completely comfortable. And when I would travel, I got to the point where like, you know what? I was good. I'm good having a periodic fast.
Mhm.
And so it would make people very, I had to help them feel okay about the fact that I'm traveling, I'm doing a periodic fast. I'm used to this. This is comfortable. This is fine. Not eating, just having green tea while you're having your meal is not uncomfortable at all to me.
Yes.
And it is way more comfortable than
Feelings
having
hurt,
my
right?
face pain turn
Yeah.
on in a new city.
Yes.
Yeah.
I do not want my face pain to turn on away from home.
No.
Yeah.
No.
No, that's true. And the reason I ask that is because I want people who are newer to this to understand. I think, it's easy to get discouraged if you
Mhm.
feel a symptom coming on and you're doing everything right. But I think with something
Well,
like MS,
yeah,
you're going to have, and that's why it's called relapsing and remitting, especially early on. You're going to have these moments, and it's okay that sometimes you may have tingling in your fingers or tingling in your feet or whatever your symptom is, even if you're doing everything right, and it's most likely going to go away.
correct.
And
It's,
it's being brought on by something, and it's just the way that this it kind of runs its course, right?
I ask people so in my classes and my programs, we teach people two steps. The first step is you look back, what were the potential triggers in the previous 24 to 48 hours? So I just listed for everyone the triggers that I have identified. And then so like, okay, well, is there a trigger I can identify? And then I ask my wife or my kids, because they'll think of things that I might have overlooked. So you identify the triggers. Then the next thing I want people to do is evaluate your self-care routine. Did you slack off? Is there something you could better improve? So over time, I have been able to continually refine my self-care routine. And another one of the benefits of having retired from the VA is that I can have a more leisurely morning. I wake up when I rarely do have to set an alarm. I wake up, I meditate, I do my workout, and I rotate between strength training, stretching, swimming. I do my sauna with sauna space, which I really like. I come back out. I do another short meditation. Then I do my cold shower.
That vagus nerve, right?
Yeah, that cold shower for 5.5 minutes. Then I do some more yoga in my bathroom. Then I do another meditation. And then I start my day.
That is
So
awesome.
so that's several hours.
Yeah.
And if I can, I try to fit in a walk around the block outside as well. Some days I can't fit that in. Some days I can't fit in my sauna. So I have to have some flexibility based on how late I managed to sleep that day.
Mhm.
When I was working at the VA and at the U, that would take up too much time. I couldn't indulge in all of that.
Right, right. So you changed some things around and now you can,
Correct.
right?
And now I can.
Yeah, tell us a little bit, what are some of the common root causes of your patients' health problems? So what are some of the
So at the very, very root cause, we're going to have genetic vulnerability.
Mhm.
And then think about the birth environment,
Mhm.
C-section, early antibiotics, breast milk or formula, high starch diet. So those are common factors. Next, early common factor are serious adverse childhood events. And the microbiome alteration increases the probability of leaky gut, which is in the early development of food sensitivities. Prematurity and adverse childhood experiences increases the cortisol response to stress, which increases the inflammation, increases insulin resistance. Those are big, big root causes.
Yeah.
The trigger that leads to the overt diagnosis of the MS or autoimmune process is typically stress. Typically, that autoimmune process has been smoldering along for years, for decades, slowly building. But what finally caused it to bloom is typically severe stress. It might be emotional stress, it might be physical stress, it might be financial stress.
Yeah.
That is the most common. Occasionally it's an infection, occasionally it's toxins, but I would say 80 to 90% it's stress.
Yeah, I see that with a lot of things. And the person that is in my life close to me that has recently been diagnosed, who knows how long the lesions were there, but I know that the first symptom came after a very stressful year. There was a severe amount of trauma in 1 year that this person had, and then the first symptom came on, and it kind of went on from there.
Yeah.
And we see this with everything. I mean, we see this with everything we talk about in functional medicine.
And think about the pandemic.
Right.
We've all had this enormous year of severe financial stress, severe stress over the political turmoil, severe stress over the difficulty we all have, including me, predicting the future right now.
Right.
And the amount of stress we had to experience while we had to figure out how to adapt, school, work, everything. So we can predict that there'll be severe health challenges that our patients will experience in 2022 as a result of the diseases that got rushed along because of this year of stress.
Right.
Yeah. That turning those genes on, or whatever, activating the response to what's been going on that they didn't even realize. Yeah.
Right.
Yeah.
That's so true. That's so true. I think Krystal was going to ask, but I'll just ask it. Like, what are the 3 things that people could be doing right now, if you were to name 3 things?
Well, I think step number 1 is think deeply about what do you want your health for? Because that will help you find the inner strength to begin working on acquiring these new skills in the area that you want to focus, because creating new habits and new routines takes some work. They won't happen spontaneously. And so understanding what you want your health for will increase your desire to do that work. Then step number 2, eat more vegetables. I think that would be really, really good. Eat more vegetables. In step number 3, I'd encourage you to find a recipe that you really enjoy and cook with your family that recipe. So you can have pleasure in making food together as a family. Because as we work to improve our dietary routines, you want your family to be in this journey with you. And so for most of us, not everyone, but for most of us, cooking together is a pleasurable, fun thing to do. Chopping up the vegetables, frying up the bacon or the sausage, or grilling the chicken together is a fun thing.
Yeah.
And so if you can have fun with your meal, have more vegetables, and think deeply about what you want your health for. Those are 3 steps that most people will enjoy. And it's easier to have change that is pleasurable.
I love
Don't
that.
you think too that explaining to your family why you're making these changes and what, I've talked to my kids, I have 3 little
Yes.
boys, and I've explained to them what life looks like in the future with eating healthy and without eating healthy. And, or, let's say you
Oh, yeah.
don't have kids,
Yeah.
let's just say you're whatever, your spouse,
Mhm.
and the thing is what people don't understand is once you start eating this way,
Yeah.
other food tastes weird. Like,
Yeah.
chemically processed food doesn't taste good anymore.
No.
So with my vets, my vets were so much fun. I learned to talk to my vets like, okay, you guys, you want to be having great sex when you're 30, when you're 40, when you're 50, when you're 70, right? Well, yeah, they want to have that. So, okay, so the best thing for having great sex is good blood flow, which means more vegetables.
I love it.
Really?
Terry, that's genius.
That is so good.
So the other conversations, in my follow-up classes, we'd have newbies and old timers. So the newbies, and this was so common, as the people are coming back for their follow-up. The ladies are so excited because weight's melting away.
Right.
Without being hungry, weight's melting away. They're really excited about that. And they might be excited that their blood sugars are a little better. The guys,
their mood is better when their blood sugar is better, right?
Their mood is better.
Yeah.
Now the gentlemen, they are excited because everything's going down, except there's something that's going up.
Yep.
They're going from 6 to 12 o'clock.
That's right.
I mean.
So they are so excited, like, oh my God, Doc, you didn't tell me that my love life would be better.
Right.
I'm waking up with the piss or heart on.
Yes. That's life changing for people.
And they are so excited.
Yes.
Now that doesn't happen at 6 weeks usually. That takes a few more months.
That's
So
a little bit
that's
more
the
long-term.
beauty of having a group that has old timers and newbies in, because it's the folks who've been in the class for several months are coming back saying like, oh my God, it is happening, Doc. And the new guys are like, what's happening? And so that crosstalk between the men who are excited by the fact their love life is coming back, talking to the newbies, and these are young men in their 20s and 30s who lost the ability to have erections due to probably the toxins in the war and the inflammation. And they're not going to admit that they're not having sex and not having erections until they hear from another young man who got it back.
Exactly.
And I think for men, that's like, if men were to make a vision board, I think that would be their number one magazine.
And it's vital for them. They need to have their testosterone working well, or their brains
Right.
will deteriorate rapidly.
It's true.
Wow.
And another thing that was really interesting in all of this is, so for the women, they too were having big changes in libido, desire, and interest in sex.
Yes.
And I think this is an overgeneralization, of course.
Mhm.
Women, we are often way too, or our priorities may be appearance.
Mhm.
Mhm.
For men, which just makes sense. We had to be attractive to get a mate. So
Mhm.
appearance matters very much to our
Yeah, in nature.
reproductive success, in our
Mhm.
ability to pass on our genes.
Mhm.
Men, for them to get a mate, they had to perform.
Mhm.
And so performance really mattered. So they would have reproductive success. So
Yeah.
men carry, biologically, it makes sense to me that they carry a lot of need to have high performance.
Mhm.
Women carry a lot of need to have great appearance.
Yeah.
And so in my classes, women are so fired up about appearance,
Right.
and men are so fired up about performance.
Yeah.
And then later, as things evolve, then men admit, well, yeah, they're losing weight too, and it does feel pretty good. And
Mhm.
women will later admit, well, yeah, it does feel pretty good. I am more interested in intimacy with my partner, and that does feel good. And it's good for the relationship, and it's good for me.
It's
Uh,
imperative for the relationship, if you
It
ask me. I think if that is an issue, and we work with a lot of people with libido issues, and we've actually just did an episode on libido because it's such a big request. Women want to have a libido. They don't
Yeah.
understand why they don't. And men definitely, the men that we've worked with that are not able to function the way that they once could, it's very disheartening for them. I mean,
Yes.
they take a gigantic hit
Mhm.
emotionally into their ego when they can't, and it's it's hard to hear, but it's amazing when that
And they
changes
exactly.
because
Yeah.
everybody's happy.
Mhm.
it's very important. Actually, I'm very excited. In our seminar, we're going to be talking more about sex, libido, and so we talked a bit about it last year. We're talking more about it this year. I think that's important for women and for men to address that, acknowledge it, and to let them know that yes, there are things that we can do um, that have a huge impact on making those problems worse or
Mhm.
better,
Mhm.
depending on what we're doing every day.
Yeah.
Why don't you tell us what's going on? What do you have coming
Yeah.
up? Tell us about the seminar.
Well, okay. So we used to have the seminar in person. Of course, this year and last year we have it virtually. And what I discovered is by having it virtually, in many ways, it is even more engaging, much
Oh,
more intimate and personal.
okay.
So we have a series of bonus calls with some brilliant speakers. So we have a presentation, and then a Q&A that I moderate. Then we have a breakout in smaller rooms so people can talk about what they've learned, and you get a chance to meet people from all over the globe. Then in May, we have 2.5 days where we have the sessions virtually again. Speaker, I moderate the questions, and we have practice sessions. So we do dancing, we do Tai Chi, we do yoga, we do belly dancing. And so it's not just sitting the whole time. We actually practice
Right.
these stress reducing techniques. We practice the movement techniques, and we have breakout sessions. When I do my sessions, I do something that's, I think, so much fun. I do the PowerPoint, a few slides, then I stop. I come back out of the PowerPoint mode. We talk, and I call on people to discuss the concept that I was reviewing in their life and their experience.
That's
And so that is much more engaging and
Mhm.
more responsive to my audience. Then I go back to my PowerPoint, and so for my portion of the seminar, it's a much more interactive, actually for me, way more fun. Because when I'm doing it in person, I can't have that same kind of intimate conversation.
Right.
Then after the essentials track, then we have 6 weeks, again, where I have a speaker, I moderate questions, and then we have a breakout for people to meet people from all over the globe and talk about their aha moments. And during the breakout sessions, I crash the parties. So I go from room to room and say hi to folks and answer a few questions. And then in July, we will have the advanced track where we have a deeper dive into various topics. And I have to admit, I can't remember in which portion the sex and libido is. So you'll have to look at the schedule to see which one that's in. So you sign up for the right one.
Yeah.
And then we have, again, after that, 6 weeks of follow-up with a guest speaker. I moderate the questions, and we'll have a breakout session. And I modeled this after the way I taught these concepts in the lifestyle clinic at the VA. So we do a timeline review. I help people understand their triggers, what their most useful domains to address might be. We're going to have a chef talk with us about cooking strategies, meal planning strategies.
Important. That's so
Yes.
great, Terry. People need that. They
People
really
don't know how to cook anymore.
I know.
We don't have those skills. So we had a chef last year. She was so good, and she agreed to come back. So she'll be there for the essentials track and for the advanced track. So, and again, we'll be practicing our stress reducing, and we'll be practicing lots of ways of moving that are so fun.
Very
And we will link all this
Yes.
show notes so everybody can get signed up. And I'm speaking April 6th with Dr. Wahls on histamine intolerance and its relationship to autoimmune disease too. So,
very
and now I'm wanting to stop and do like a dance party in the middle of my slides because you've just inspired me. I have to tell a funny story. So this is how I met Dr. Wahls. I met Dr. Wahls a couple of years ago at a conference. And when I first saw her, I was like, oh my gosh, Dr. Wahls. And I didn't feel that I could approach her at that time. No, I didn't. So then the next year I saw her, but we were in a much more like a smaller, more intimate group. And we were sitting at the same table, and it was her and one of her assistants who I'm actually really good friends with. And we just clicked and just were talking, and she was so great to me. And she offered, to help me in any way she can. But the thing that I remember the most, and the thing that made me just fall so in love with you, Terry, is every, once in a while during the seminar, we would get a break to dance. The music comes on. There's a DJ at this seminar, and she gets up with zero shame.
I love it.
And I'm like not a shy person, but I'm sitting in my seat. She gets up and just dances. And every single time. And I love that about you. And I mean, it probably has something to do with the fact that you were stuck in a wheelchair for several years.
Exactly.
But I just think it's so amazing. And I'll never forget that. And I just, ever since I saw that, I was like, this woman is amazing. And
amazing.
I was like, I don't care if she wants to be friends with me. I'm going to be friends with her, whether she's not.
Now, if I remember correctly, I think I also stood up on the chair. Started dancing as well.
You did. Oh, yes, you did. In front of a room full of hundreds of people. She did not care. And she could dance. I was like, what?
Love it. I love that. I love
that. It was great.
Becky, before I went to medical school, I did Taekwondo. I competed nationally.
Oh my gosh.
And in the Pan American trials, I was a bronze medalist.
Wow.
So it was a very big deal. Then I entered medical school, and I learned that maybe I should not be letting people punch me and kick me in the head anymore. So,
Oh,
Great
goodness.
point.
so
Right.
I didn't do those competitions anymore.
Yeah.
No, but I'm reading your story. Terry has been very active her whole
Yes.
life. So, and you know, this is the thing with the person in my life. You know, he is the most active person that I've ever met,
Mhm.
and it's very, you know, hard to, I think, accept that if you are a very active person, you know, like the first thing you would think is, why is this happening to me? I'm so
Mhm.
motivated. I'm so, you know, I move so much. And I love that part of your program is keeping people moving, because that
Yes.
is so important. And no matter what that looks like for you, keeping moving is an extremely important thing with every single issue you could possibly have going on, especially with
Yeah,
multiple sclerosis, for sure.
For
it will
sure.
be huge. It's all the difference in whether or not you will be able to maintain independence throughout your life.
Yeah,
So
definitely.
Terry, as we wrap this up, where can people learn more about your research and work? Where can they
Okay, so come to terrywahls.com.
Mhm.
And if you add /diet, you get a one-page summary of our diet program. If you add /research papers, then you can get access to our various research papers.
Yeah. Awesome. Well, thank you so much for coming on here. It was such a pleasure meeting you. You're amazing.
And you guys can find her books too everywhere, right?
Yes.
Amazon. She's
Yeah.
written an amazing
All
book.
those
Just
beautiful
had an
babies.
update. It's
There we go.
update Wall's
There's the
protocol.
update.
This
Um,
book is
came-
amazing. It's amazing. It's a very easy read. It's laid out very well. And
Mhm.
I recommend that if you have any issues with this, if you know anyone who has issues with this, you pick up that book. I mean, that would be a very good starting point, because it really lays it out for you and it teaches you what to do. And it
Mhm.
really does make all the difference.
It really
So we love that book. That was the first thing I did when I found out this person had MS, as I sent them your book.
I
Oh,
remember.
perfect.
So,
Perfect.
Yeah.
and
It's
I have my
life-changing.
MS awareness bracelet on today.
Yes,
Love
yes.
it.
You know, and it is so gratifying. 10 years ago, they was really condemned by so many neurologists for my message.
Yeah.
But now, 10 years into the future, many more neurologists are saying, you know what, they still want them to take disease modifying drugs, and depending on those circumstances, that may be appropriate. But now the message is also, drugs are not enough. You have to address diet. You have to stop smoking. We
Yes.
need to have you address stress. We need you to move. So it's like they finally read my book.
Right.
I'm not anti-drug. I
Right.
am pro vegetables. I
Yes.
am pro stress reduction. I am pro movement and pro getting you to the simplest, least toxic drug regimen that is possible.
Right.
And when appropriate, off drugs.
Yeah.
Because if you don't do it that way and you just go on the medication and you don't follow the diet and the stress reduction
Disease
techniques,
progresses.
movement,
It
the
progresses.
disease progresses big time and quickly.
Yes.
And you have side effects and all of that, even from the drugs. So it's
And you will get other autoimmune diseases. You'll
Yep.
get a new autoimmune disease every 5 to 10 years.
you're
Ugh.
3 times more likely, right?
Yeah.
to have one.
And so you want to get to the root cause, and you want to address all the comorbid problems that will develop: obesity, insulin resistance, diabetes, high blood pressure, anxiety, depression, heart disease. That, and now they're beginning to talk about that. And now people are, many more neurologists, in fact, are telling their patients, do the Mediterranean diet, do the Swank diet, do the Wahls diet, but do some diet.
Right.
Yeah.
Exactly. Yeah.
And more neurologists are saying, and actually what is really the most interesting, the nurses in the infusion centers are giving patients the book or my name, saying, you also need to pick up Walls's book.
That's
And the nurses in the doctor's office are also saying, you need to pick up Wall's books. And more neurologists are also saying, you really ought to read what Wahls has to say.
That's amazing,
It
Terry. That is
is.
huge.
Big changes. That's where
It
you
is.
see big changes.
You know, and when our papers come out, even more will say that.
Right. The more research.
I
Exactly.
can't
You have
wait
to have
for
the
those
more research.
papers.
You do.
It'll be exciting. It'll be exciting.
Doing
No,
what you're doing, girl.
We presented our work at ACTRIMS
Mhm.
last fall. We'll be presented at again. We have more studies coming out at ACTRIMS, which is the big MS research and treatment meeting that happens in September and this year. Oh, actually, that just happened in February. Then we'll be presented at the Consortium of MS Centers again this fall, and we'll have more again in the ACTRIMS meeting. And what I see happening now forever is because we have so much data in our lab, we'll keep having research that will get presented in these big scientific meetings every year. And so, you know, they ignored me for a while. They're ignoring me less.
Mhm.
People are agreeing with my message.
Mhm.
The standard of care is shifting. It used to be drugs. Nobody talks about diet and lifestyle. Now it's drugs, and more people are talking about you got to stop smoking. Diet matters, lifestyle matters, and that will become the standard of care. That we expect diet and lifestyle to be talked about. They don't know who to refer these people to because there's not an approved diet for MS yet,
Mhm.
but we'll be changing that soon.
Okay.
It is changing
Awesome.
over time. It
Yeah.
still amazes me sometimes when we see patients who say, you know, my doctor told me diet has nothing to do with my
Yes.
condition. And I'm like,
You'll hear it.
it has
It's just
everything to do with it. Everything. And
It has everything to do with it.
it
it's
does.
just, this is why I'm so grateful for your practitioner program, because people need to learn, you know, they need to
Well,
learn what to do.
yeah, you know, and the part of the message I have in my book and to the public when I'm talking about this is, it's fine that your specialist doesn't know about diet. That's okay. They have a lot to learn to
Right.
manage all those drugs. But
Right.
your primary care medical team should feel very comfortable supporting you in eating more vegetables.
Right.
They should feel very comfortable supporting you in learning how to meditate. They should feel very comfortable in supporting you learning how to move more.
Mhm.
And so deal with your subspecialist in terms of the drug question. Do you
Right.
need drugs or not? Deal with your primary care team with the desire to have support on how you improve diet quality, stress reduction, and movement.
Mhm.
There's so many wonderful modalities out there now too, you know, for like, you know, eSTEM and all that. But I mean,
Yeah.
so many great things that I've learned. Just my boyfriend is an athletic trainer, and he knows all of these amazing techniques, and that I didn't even know, you know, when I was doing chiropractic.
So
That
does he do blood flow restricted band therapy?
he has the I can't remember. He puts the boots on and they tighten and they
Oh
squeeze.
yeah, I know about that.
He has that. He does the balls like to strengthen and all that. I mean, he does tons of eSTEM. He has all.
So let me pitch an idea to him
Okay.
that you know, because we'll be looking for people to speak next year.
Okay.
Ooh.
This might be a very nice topic for us to cover. What are the additional modalities that we could access through an athletic trainer?
Yes.
So
He
great.
And
does
tell
that.
him that I'm looking for someone who will talk to us also about blood flow restriction therapy. So be sure that he includes that
I will.
in the therapies. People have difficulty figuring out how to access eSTEM.
Mhm.
So if athletic trainers have expertise in supporting people with eSTEM,
Mhm.
so I could see this would be a very valuable talk for our
Yeah.
2022.
Yeah, he's doing that, and he's also now certified in functional medicine. So he's
Oh,
really
perfect.
putting it all together. I mean, I am so excited for him because he's learned so much from you and he's learned, with my practice with functional medicine, and he went through the course and he's got his wall certification, plus on everything he knows from athletic training. So he's pumped. He's ready
Ready
to
to
go.
roll.
Yes.
There's certainly a nice opportunity for neurofitness
Mhm.
Yeah.
with an athletic trainer who has a functional medicine perspective on
Mhm.
helping us integrate in our recovery. So yes, I'm thinking that would be a great addition to 2022.
I
It
think
would.
we will
Dr.
set
Campbell, can you help facilitate that?
I will make sure that happens. You know that.
I love it.
Well, Terry, it's been so amazing having you.
Yes.
You know, I adore you in 100 different ways. But we are so grateful that you came on and talked with everyone. And we love how real you are and how,
Yes.
you've lived this, and you are such a good source of information, and how much effort you have put in to researching what the right thing is to help people who are struggling. So we thank you so much for all your work and for coming on and talking with us. We're so excited that you've been here today with us, and this is going to be such a great episode.
It is. I'm pumped.
Thank you so much.
Yes. It was nice meeting you.
Thank you.